Hey everyone, my name is Luke Adams. I am a nurse from Pennsylvania, but I'm in New York treating COVID-19 patients. I've been here for a little over a month now. This is about halfway through my 5th week. I plan on being here until close to the end of June, so I'm not quite halfway there yet, but definitely have been here long enough to share a few things that I've learned and experienced, and certainly been here long enough to not be able to wait to get back home. The first question that everybody always asks is, what's it like here? It is definitely different than anything that we've ever experienced in healthcare before here in New York. Okay, I fully recognize that there are plenty of places where things are still, business as usual, and I'm happy for that. It's certainly not the case here. Here, we came very perilously close to not being able to treat the amount of people that were coming in. We were running out of equipment and also running out of, competent staff to be able to take care of them. When you think about what a typical day is in terms of being a nurse, a critical care nurse at that, we have, let's say you have a 10-bed unit, you might have 5 or 6 nurses to take care of those 10 patients. Here, it's almost inverted. You have 1 nurse for 10 patients, In my case, I was kind of in an open concept, no doors, 16 beds separated by curtains. That's been the unit that I've been in. And I do have, some residents. I do have some med surg or tele nurses with me, but I started out that I was the only critical care nurse to take care of 16 people, very, very sick, critically ill people, which is obviously incredibly different than a normal day as an ICU nurse. These people were sedated, they were vented, they were sometimes paralyzed intermittently, continuously, and again, we didn't have the monitoring systems in place that we normally do. So, having all that equipment is great, but it also is a little bit scary because, I'm used to being able to kind of look into a room and go, okay, I see everything that I need to see to make an accurate assessment of what I'm doing. But that didn't exist, so I had to, more often than not, physically go in and figure it out for myself. And so on 16 people, that's a lot. And if one of them gets really sick and needs my attention, in your mind, you're going, okay, what's going on in the other 15 rooms since I'm not there? So that has led to, obviously an increased stress level for me, but also for everybody else in the hospital because, I came in and expected to be doing things that I had never done before. And certainly that's been the case, but it's also true for the staff that is already there. One of the things that I've learned is how tenuous morale can be in a crisis, right? You don't have many victories. We weren't having many victories in the critical care units. It was just kind of poor outcomes, if you want to call it death, every day, and that's tough to be around, even for people like us who deal with it on a daily basis. Normally, the amount was certainly tough to deal with, and so, a thank you or just some support from your hospital, your management, or even the local community goes a long way, and that's all we can do as people, As I alluded to, we're not having a whole lot of success in the ICUs with these patients. There is a great amount of debate in not only the medical community, but in the community at large about how to treat these patients. Hydroxychloroquine, yes, we tried it. Zinc, vitamin C, we tried it. We tried, a lot of the things that have been recommended from the beginning. A lot of them have not worked. I've not seen a significant treatment that has worked. And I think a study was just published, a very small sample, that the hydroxychloroquine may have actually had poorer outcomes than actually we thought. So, I think when we look back, when we do get some distance and we do have some time to research and learn about this, unfortunately, I think we're going to look back at this and go, a lot of the things that we did not only were ineffective, but may have done more harm than good. That's just my gut feeling. It's an unfortunate thing, but that's what happens when you are faced with something that you've never dealt with before. You know, you have a lot of head scratching, and the best thing that we can do is take the information that we have available to us, make a decision, stick to it, and try, if it's not working, to be flexible and learn on the fly. And that's what I've seen from all the medical professionals. My hat's off to everybody who's treating these patients. It's not easy, it's frustrating. And with all the messages coming in from the outside, everybody wants to try something, but we don't have the resources for everything. So largely most of what we've tried here, once you're that sick, has been ineffective. This is such a divisive issue. That's what we do in America, right? We take an issue and we pick sides, and then we yell at the other side. But like I alluded to earlier, everybody has a valid argument. Certainly I know ours in healthcare, but I also, am a small business owner. I'm also the son of a father who owns a small business as well. And certainly, being shut down as a country for this long has its problems. So hopefully we cannot point fingers or yell at each other, but just understand where both sides are coming from and make a decision on how to proceed forward, which I think is starting to happen. But just remember, in times like these, there's always going to be people who believe something different than you, and that's what America's all about, right? Is the ability to say, I don't agree with you. Hopefully they do it respectfully, but we will get through this together. That's the only way forward.